This is Essequibo. Well, after completing our hospital visit, it was time to hit the road again and head over to the construction site to hear from regional officials about the need for such a medical facility in Region Number 2. Of course, we took some time out to go check out the multi-purpose stadium being constructed at Regina, and we even passed by a few schools, giving you a glimpse of life in Essequibo. At the site, we first had a chat with the regional chairperson for Region Number 2, Mrs. 𝐓𝐆 𝐓𝐇𝐈𝐍𝐆. Tell us about the benefit for citizens from other regions that is on.
Well, as you know, as Region 2, we also service Region 1. Persons coming from Region 1 to have service here, like the pregnant mothers and accident cases, and so come directly to Region 2. So this facility will definitely be an ideal hub to service both regions, not only Region 2, but also even the islands around Wakenham and so on would come right here to Region 2. And we also, as you know, we're building our brand new training facility, so we will have trained persons working here. So this will benefit Region 2 tremendously, because this is a part of job creation also. As you know, persons don't have to leave the region to go and get training, so they will be trained and they will be able to serve right here in the comfort of their own home. So this, I think, is a tremendous intervention for Region 2, and the residents is definitely, they can't wait for the hospital to get up and running, I must say. So, and of course, you know, our health service improvement is one of our President's top priority, to improve the health service right across Guyana, and Region 2 is no different.
Also joining us, Regional Member of Parliament, Mrs. Nandrani Kunja.
Today I'm on site at Lima, where this new hospital is building. And I want to say that in the past, healthcare, we used to always say primary. But today, our government is giving us, the resident of Region 2, a modern health facility. Only last week, the sod was turned at Sadi for the new training school, where many nurses and other health officials are going to be trained. And you might know in Region 2 that the youths have the capability, because we're tapping not only the country, but the Caribbean, and over time. So we can do it. With the help of our government, Essequibo is going to shine.
We also spoke with the Deputy Mayor of Regina, Lorna Fitzallen.
This project is going to benefit the people in the township immensely, because as we can see there now, the Sadi Hospital we have a distance there when we want to get our sick. We have to travel some distance, but this here is going to be in the center of the township, so it's going to be faster to get to, and it's going to be a quicker service for us in the township, for the people in the township. And it's a very, very good project. I know the government is very, very clear on serving the people in the health sector, give them proper healthcare services.
Councillor Param Singh was also present at the construction site.
So the Lima Regional Hospital Complex here falls directly or in the heart of the Regina municipality. It has been positioned here at a very ideal spot. It's ideally midway of Region 2, on the coastline that is. And this actually area here, Lima, is a highly populated area. And the persons also from Charity, this would be a half of their distance would be cut short, rather than having to go all the way to the study, which is another halfway of the Essequibo Coast. So costs there would be cut. There will be savings in their pockets in terms of transportation. Secondly, the stress would be offloaded from them having to do all of that traveling and having to deal with traffic with the advent of all the vehicles and so on the road. This investment here is very much happens at an opportune time, in that it is going to bring certain facilities medically that are normally not available here on the Essequibo Coast or in Region 2 or in the municipality. It will definitely alleviate persons having to travel to maybe Georgetown and even out of the country to access these very much needed health checkups and maybe to correct those ailments as well. Also, I want to stress that the residents in the outlying communities here, apart from health, would be benefited in terms of employment, right? And I want to state this very quickly that my ministry, we're training persons under the WIN program, Women's Innovation Investment Network. And with those students who were trained under child care and patient care would be eligible to be trained as nurses to come and be absorbed at this hospital.
They have the training school.
And the training school is being set up here, and there are persons who are training here as well. So all of those persons who are interested in nursing and who we would have been trained, with this hospital, I understand there is going to be a need for about 300 odd nurses and patient care persons. So Essequibo is going to be benefiting, and the Regina Town Council residents here will be benefiting tremendously with the setting up of this hospital. And we're so much looking forward to it.
We got the opportunity to catch up with the site manager, Mr. Chang from China, who gave us an update on the progress of the works at the facility.
Area because most of the material, anything we need to get it from the Georgetown, so it is very difficult to transport to this area. So everything we need to work very hard to contact with the local supplier or anything.
So the project is on
schedule.
schedule.
No, it's on schedule. No worry about it. Yeah.
Right.